Welcome to Making Cancer History. I'm Carolyn Gotay. In April 2008, I was appointed as the Canadian Cancer Society Chair in Cancer Primary Prevention at the University of British Columbia. Cancer is the #1 health concern today and affects thousands of people in British Columbia. In 2008, we estimated that more than 20,000 British Columbians would be diagnosed with cancer, and over 9,000 would die from the disease. Cancer has a significant effect on the quality of life, economic status, and the well-being of cancer patients and their families. Although the overall health of British Columbia's population is better than other parts of Canada, some British Columbians experience poorer health than others. Health challenges come from our inherited genetic profile as well as our environment. Evidence shows that Canadians with adequate shelter, a safe and secure food supply, access to education, employment, and sufficient income for basic needs adopt healthier behaviors. Because of this, they have better health outcomes than those who come from poorer or disadvantaged backgrounds. The social, economic, and environmental factors that influence health and contribute to health inequities are known as the determinants of health. They account for the difference in health status between the healthiest and the least healthy. We need to take a closer look at what these inequities are. Differences in social standing, economic prosperity, and environmental factors pose significant challenges for many British Columbians. Poverty, which is often linked to low education and employment levels, is also often linked to poor health. BC has the highest rate of childhood poverty in the country. In a public opinion poll done in May 2008, a quarter of people taking the survey named healthy food being too expensive as the single biggest factor to making healthy choices about what to eat. We know that at least 50% of cancer cases can be prevented through healthy living and healthy public policies or changes to the system which safeguard the health of British Columbians. The Canadian Cancer Society believes that the primary prevention of cancer, or stopping cancer before it starts, will help raise the health of children and families and help improve the strain to our healthcare system and the economy. In order to steadily reduce the risk of cancer, the Canadian Cancer Society promotes activities that benefit good health and advocates for public policies that help make healthy choices the easier choices. An approach supporting personal health management through education of the population is needed, but we also need public policy that fosters healthy environments. These combined approaches have the greatest potential to reduce the incidence of preventable cancers caused by the common risk factors such as tobacco use, being overweight, unhealthy eating, and physical inactivity. The Canadian Cancer Society is calling on the BC government to create a strategy where all government ministries have a specific plan in place to support the reduction of health inequities and improve the health status of all British Columbians. A population health approach, a focus on primary prevention, and effective education and behavioral intervention programs can improve the quality of life for all British Columbians, as well as reduce the levels of cancer and other chronic diseases.